There are two types of people in Portland. Someone who's had something happen to them and someone who will have something happen to them. There's no in between.
What you've just seen is the reality unfolding in Portland, the largest city in the state of Oregon, the economic and cultural center, and the place with the highest concentration of population, business activity, and the most vibrant urban life. It's also the epicenter of the homelessness and drug crisis in the entire state of Oregon. Yeah, it sounds a bit hard to believe, right? But if you walk through downtown, you'll see it for yourself. Rows of tents stretching along the streets, piles of belongings stacked up, and countless people simply trying to get by day after day. According to the latest point-in-time count report, Multnomah County alone, where Portland is the heart, now has more than 10,500 people experiencing homelessness, an increase of up to 67% compared to 2 years ago. And for the whole state of Oregon, the number has climbed to over 27,000 people. You know, this problem doesn't just affect the people who are struggling. It also touches urban security, the city budget, and even the entire image of Portland itself. And what do you think if I tell you that even though Mayor Keith Wilson has worked hard to open a record number of shelters and roll out new policies, the situation still hasn't improved the way everyone hoped? If a wealthy, developed city still ends up in a situation where thousands of people have no place to live, then where does the fault lie? Is it the individuals or the system? Or is it both? You know what I mean, right?
I didn't choose, in third grade, when the teacher said, "What do you want to be when you grow up?" I didn't say I want to be homeless.
But what makes Portland so special is the way all those problems collide with each other all at once, in the same space. On one side are the efforts to help. On the other side is the pressure to maintain order. And in the middle are the people who are stuck. What you think? If you were living there, how would you feel? Portland is not just an isolated story. It could be a mirror reflecting the future of many other cities. Moreover, those strict camping ban orders recently, in the end, are they really helping the vulnerable or pushing them into a dead end? But that's not all. A serious intestinal disease, Shigella, is on the rise in this city. And what's noteworthy is about 1/3 to half of the cases are actually linked to homeless people. Yeah, you didn't hear wrong. A problem that was originally thought of as personal has now turned into a public health story. If you're interested in the real social issues in America, or simply want to understand more about Portland, the city once called the Rose City, then the next part will definitely be worth watching. Trust me, what you're about to learn will completely change the way you look at this crisis. And especially, there's a political bomb that's going to explode next November, something that could completely determine the fate, once again, of tens of thousands of people here.
You don't know you're not going gay.
The raw truth hitting Portland streets right now is this: the drug crisis isn't riding shotgun with the homelessness disaster, it's driving the whole damn thing. Fentanyl didn't just spike deaths, it turned sidewalks into a survival grind where one bad hit can end everything in minutes. Straight up, Multnomah County logged 779 overdose deaths in 2023. Fentanyl still dominates, often mixed with meth, leaving users physically wrecked on the pavement, veins collapsing, and bodies piling up on cold concrete. Was Measure 110 a bold public health move, or the policy that poured gasoline on the fire? Because the city just executed a complete 180-degree policy flip. HB 4002 recriminalized small possession starting September 2024, up to 6 months in jail unless you enter a treatment deflection program. From full decriminalization to strict accountability in just 4 years. This massive swing is already shaking the streets hard. More arrests, more pressure on users, and heated debates about whether it's saving lives or simply pushing the most vulnerable deeper into the shadows. And get this, roughly 1/3 to half of the surging Shigella cases, that vicious gut bug spreading like wildfire, trace straight back to the unhoused and drug-using crowds.
No symptoms do include diarrhea, fever, stomach cramps, and sometimes vomiting, and can last 3 to 10 days. Now, if you do think that you have Shigella, you are asked to get tested and isolate immediately, as it easily spreads.
What started as a personal choice problem has exploded into a full-blown public health and public safety street war, hitting both addiction recovery and community security at the same time. Bottom line, from someone watching these blocks every day, the numbers are finally bending downward thanks to this dramatic policy shift, but the physical grind on the pavement hasn't eased one bit. The real test now is whether this hard 180-degree turn on drug policy, combining enforcement with treatment, actually pulls people off the concrete or just shoves the entire crisis around the next corner, while public safety and community health hang in the balance. One of the most shocking recent incidents in Portland was a fatal shooting at a Plaid Pantry convenience store in Northeast Portland in late March 2026. At first, it might sound like just another isolated crime, right? But what really unsettled people wasn't just the incident itself, it was how and where it happened. In a normal neighborhood, at an everyday workplace, an act described as heinous unfolded without warning. And that raises a bigger question: how safe is the city really? Local officials quickly responded, condemning the violence and emphasizing the seriousness of the situation. But, you know, that sense of unease doesn't just go away overnight. For many residents, events like this are starting to feel less like rare exceptions and more like part of a pattern. Now, here's the key point. Even though this incident was not directly caused by someone experiencing homelessness, it took place in an area with a high concentration of encampments, and that matters. These areas are often harder to manage, less consistently monitored, and more likely to become hotspots where multiple social issues overlap. You know what I mean? As a result, downtown Portland is increasingly being associated with instability. Residents feel more cautious, businesses grow more hesitant, and a general sense of uncertainty begins to spread. And maybe the most important takeaway is this: this isn't just about one incident. It's a reflection of a much larger challenge where homelessness, broader social issues, and urban safety are starting to intersect. So the real question becomes, how do you balance compassion with public safety? What do you think? Here's the uncomfortable truth. Policy in Portland isn't failing because nothing is being done. It's failing because what is being done doesn't match the scale or speed of the crisis. Start with shelters. The city has been aggressively adding beds, hundreds at a time, including recovery-focused spaces tied to addiction services. On paper, that sounds solid. More beds equals fewer people on the street, right? Not exactly. Because when you look closer, intake rates are slower than inflow. People are entering homelessness faster than the system can process them out. So even as capacity expands, the street population barely moves. It's a throughput problem, not just a capacity problem. And then here's the first real tension point: enforcement. The city has shifted towards stricter policies, clearing camps, restricting where people can sleep, pushing visibility out of high traffic areas. The logic is straightforward: restore order, reduce risk, stabilize neighborhoods. But here's the catch: removing a tent doesn't remove the person. It just relocates the problem. Sidewalk to side street, downtown to outer blocks. Same people, same conditions, different coordinates. So let me ask you, are we solving homelessness or just managing where it shows up? Now, layer in federal involvement. Recently, national level advisors have stepped in, holding direct meetings with city leadership. That signals something important. This is no longer just a local issue. It's being treated as a national stress point, funding strategies, enforcement models, treatment pipelines, all under review. But coordination takes time, and time is exactly what the street doesn't have. Meanwhile, the most critical metric, exits to permanent housing, is underperforming. Fewer people are transitioning from shelters into stable housing compared to previous years. That's a structural bottleneck. You can build all the temporary space you want, but if there's nowhere to move people next, the system jams. Shelter becomes a holding zone, not a solution. And yeah, budget pressure is tightening everything. When funding gets stretched, services get thinner. Outreach teams shrink, case management slows down, and suddenly the margin for recovery disappears. Survival mode kicks in, both for the system and the people inside it. And here's the hard question nobody wants to answer. What happens when the system designed to stabilize people starts operating in survival mode itself? So where does that leave us? In a loop. Policy pushes for control, services push for support, but neither side fully closes the gap. And on the ground, that gap is exactly where people fall through. This isn't just a housing issue anymore. It's a layered system failure where every weak point amplifies the next. And once you see it from ground level in Portland, it's hard to unsee. Start with public health. When people are living outside, no consistent access to clean water, restrooms, or basic hygiene, disease spreads fast. Not hypothetically, but physically, block by block. You're dealing with open exposure, shared surfaces, tight encampments. That's how outbreaks move. And once someone gets sick out there, recovery isn't a straight line. It's disrupted sleep, missed care, zero stability. Health declines, mobility drops, and just like that, the chance of getting back into housing slips even further. Now layer in inequality. Certain groups are hit harder, and not by accident. Limited access to services, slower placement into shelters, fewer support connections, so even when resources exist, distribution isn't even. That creates pressure pockets, clusters where the situation escalates faster, stays longer, and becomes harder to reverse. It's not just unfair, it's inefficient. Then comes the economic drag. Downtown activity dips, foot traffic drops, businesses pull back, and when that happens, job opportunities shrink, especially low-barrier jobs that people on the edge rely on. So now you've got fewer ways out, right, when more people are falling in. It's a feedback loop. Instability drives economic slowdown, and that slowdown feeds more instability. Here's the part people don't want to admit. When the local economy weakens, homelessness doesn't just increase, it accelerates. And yeah, social tension adds another layer. Protests, policy clashes, public frustration, all of that pulls attention and resources in different directions. Instead of a focused response, you get fragmentation. Different agencies, different priorities, different timelines. On paper, it looks like action. On the ground, it feels scattered. But the real engine behind all of this? The loop. Once someone falls into street conditions, everything stacks against them. Lack of sleep affects decision-making. Health issues reduce mobility, missed appointments delay services, then enforcement moves them, new location, new disruption, reset the cycle, over and over again. So ask yourself, if every step forward gets canceled by 2 steps back, is the system broken or is it working exactly as it was built? And that's the uncomfortable takeaway. These aren't isolated problems. They're interconnected stressors feeding one outcome, which means unless you break the loop at multiple points, housing, health, income, policy, nothing really changes. It just shifts shape. The budget is flat out collapsing in Portland right now, and it's dragging the entire homelessness pipeline down with it. But here's the first gut punch. City Hall just admitted a brutal $169 million shortfall that's sucking the oxygen out of every shelter and street cleaning crew. They need $54 million immediately just to keep the overnight shelters and tiny home villages from going dark, plus another $13 million to haul away the mountains of tents, trash, and human waste piling up on sidewalks before summer hits. Without that cash, the physical reality on the ground gets uglier fast, more bodies sleeping rough, more encampments blocking doorways, more crews overwhelmed and burning out. On top of that, Multnomah County is staring down a $68 to $87 million hole of its own. Their fix? Straight up proposing to slash 675 shelter beds across 9 sites, with 7 of them shutting completely. We're talking the big ones. Market Street and Y East closing their doors for good. Even the nonprofit Sunstone Way is pulling the plug on 6 more facilities starting July 2026. This isn't some spreadsheet tweak. It's cutting the literal roof over people's heads when the streets are already the coldest, wettest lifeline left. And yeah, that raises a nasty question. Is this accountability or just politicians kicking the can so far down the road it rolls right back into the river? Here's the second hook that's got insiders whispering city accountants just stumbled on $106 million in unused housing funds sitting in the bank. Now the scramble is real. Redirect it to rent assistance and eviction prevention, or watch the unsheltered numbers explode again. The brutal math doesn't lie. Every bed lost means more folks cycling through the system without a permanent exit, more fentanyl-laced chaos downtown, and more taxpayer dollars burned on endless cleanups instead of solutions. This shortfall isn't abstract policy talk. It's the difference between a guy getting one more night inside versus freezing in a doorway with nothing but a tarp and a prayer. The clock is ticking, and Portland's safety net is running on fumes. This isn't just a homelessness problem, it's a systems failure under pressure. And right now, Portland is running that system close to its limits. Strip everything down, and the core variable is still housing. Not temporary beds, not short-term programs, actual, stable, affordable units. Without that endpoint, everything else backs up. Shelters overflow. Outreach slows, enforcement cycles repeat. It's basic flow dynamics. Input exceeds output. The system clogs. And once it clogs, recovery becomes exponentially harder. Now here's where it gets uncomfortable. There's a real debate happening, not in theory, but on the ground. Do you prioritize stability first or control first? Do you invest heavily in long-term housing pipelines, or do you tighten rules to stabilize public space immediately? Both paths cost money, both carry risk, and neither works fast. So let me put it straight. What matters more, fixing the root or controlling the symptoms right now? At the same time, policy inconsistency is a hidden drag. Programs start, shift, stall, reset. That instability alone burns time and resources. Meanwhile, people on the street don't get a reset button. Every delay compounds, physically, mentally, financially. And then there's coordination. Housing, healthcare, addiction services, legal systems, they all intersect here. If they don't move together, the weakest link breaks the chain. That's exactly what's happening. And here's the bigger question. If a well-funded U.S. city can't stabilize this, what does that say about everywhere else? So looking forward, the direction is clear. Even if execution isn't, long-term housing supply has to scale, policy has to stay consistent, and systems have to integrate, not compete. Otherwise, this doesn't resolve. It just shifts, expands, and repeats. Because at the end of the day, Portland isn't just dealing with homelessness. It's testing how a modern city handles sustained pressure and whether it can adapt before the system breaks completely